Good morning from Indonesia. My name is Irianiwati. I'm a pathologist. First of all, I would like to say thanks to the committee. Allow me to present my research of stromal tumor-infiltrating lymphocyte in Indonesian triple-negative breast cancer. Breast cancer is a heterogeneous disease both in histopathology, therapeutic response, metastatic pattern, and prognosis aspect. Based on the immunohistochemical profile of ER, PR, HER2, and KY67, breast cancer is classified into luminal A, luminal B, HER2 enriched, and triple negative. Triple negative is the most aggressive cancer with a frequency around 15 to 20%. Triple negative breast cancer characterized by the negative expression of ER, PR, and HER2. This cancer mainly occurs in younger age associated with BRCA mutation, with large tumor, high-grade, high lymph node metastasis, multifocal and multicentric tumor. Tumor heterogeneity of TNBC is shown by the high proliferation, P53 mutation, high PI3K pathway alteration, high RB alteration pathway, high genomic instability, and hypomethylation. This cancer is unresponsive to endocrine and any targeted therapy, and thus chemotherapy is the only treatment choice. This tumor also associated with high chemoresistance. Triple negative has rapid progression with the median overall survival less than 1 year. Survival rates of TNBC are lower than other breast cancer subtypes. Stage 3 to 4 triple negative breast cancer, the 5-year survival rate is only 30%. Molecular subtype of TNBC classified into basalike 1, basalike 2, immunomodulatory, mesenchymal, mesenchymal stem cell-like, luminal androgen receptor positive, and unclassified subtype. This subtype facilitates understanding of the heterogeneity and as a foundation of the specific therapy. TNBC is more immunogenic compared with other breast cancer subtypes, in which mutation rates of TNBC is higher than the other subtypes. And also, TNBC shows the highest rate of T cell infiltration among breast cancer subtypes. Tumor-infiltrating lymphocyte in triple negative breast cancer, many studies found that both intratumor and stromal TILs can be used as a predictor of good prognosis in adjuvant and neoadjuvant setting. Recommendation from the International TILs Working Group on Breast Cancer suggest the evaluation of TILs on HE stain slice with focus on stromal TILs. The presence of TILs in breast cancer is important. It can be used for the selection of patients who are benefit for chemotherapy such as carboplatin. And high number of TIL also associated with pathological complete response, and TILs can be used as predictive marker of immunotherapy response. Our study aimed to investigate the association of TILs, stromal with clinical pathological parameter and survival in Indonesian triple negative breast cancer patients. Material and methods. we use 125 cases of triple negative breast cancer taken from Sarjito General Hospital, Indonesia, year of 2008 until 2017. Stromal TIL evaluation was done on HE staining slide and conducted by 2 independent observers. Stromal TILs were counted in 5 randomly selected high-power field of 550 times 40 time magnification, and the counts were averaged. Initially, TILs were recorded as +1. The score is 1 to 20%, and +2, the score is more than 20% in the stoma. TILs up to 20 cells were considered as low, and above 20 cells considered as high score. The association of stromal TIL with clinical pathological factors and survival was statistically analyzed. This picture showing the stromal TILs in HE staining slide, showing the low score and high score. Research and discussion. By using 150 cases of Indonesian breast cancer, we got the frequency of triple negative was 29.3%, and using 247 cases, we got the frequency of the TNBC was 25.5%. Those results was relatively high, similar with the frequency of the TNBC among African ancestry and also Indian population. Several factors influence in the high frequency of Indonesian TNBC patients, including family history of breast carcinoma, lifestyle factor, reproductive factor, socioeconomic status, screening behavior, and genetic susceptibility. For the basal-like subtype breast cancer, we use EGFR and CK5-6 marker, and we got the frequency of basal-like cancer was 67.1%, and for the androgen receptor breast cancer subtype, we got 50% androgen receptor breast cancer. Our study showed the association of basal-like breast cancer with unfavorable factors such as younger age and shorter overall survival, and also increase of androgen receptor expression. Out of 125 TNBC patients, majority of our cases were more than 50 years old, high grade and late stage. 50.4% of patients still alive up to the end of the study, and number of patients with low stromal TILs were 54.4%. In our study, we got that stromal TILs were not associated with age and survival. These results differ with other previous studies, which found that high stromal TIL were associated with a better survival. But we got that stromal TIL were associated with grade and stage. In our study, stromal TIL were associated with a higher grade and the lower stage of Indonesian triple negative breast cancer. But up to now, there is no standardized methodologies for TIL measurement and also cutoff value of TIL to predict therapeutic response. Recommendation from the International TIL Working Group suggests 50% as the threshold for LPBC, but still unsuitable use because of low proportion of the cases. Therefore, several researchers use different thresholds of TILs, including 20%, 25%, and 50%. Therefore, standardized cutoff of TILs is needed for integrating this parameter in standard histopathological practice and clinical setting. As a conclusion, stromal TILs in our study were associated with a higher grade and lower stage in Indonesian triple breast cancer patient, and no standardized methodology for TILs evaluation nor the cutoff value of TILs influence in the research results. It seems that standardized cutoff of TILs is needed for integrating this parameter in standard histopathological practice and clinical setting. Thank you very much for your attention.